everybody, and thank you for joining LinkedHealth Innovations and LinkedHealth Pensacola's Get Talking webinar and podcast series. As always, our Get Talking series will be published on our YouTube channel to watch later and published on our Apple Podcast channel so that you can listen to the event as well. I am Todd Fisher, founder of LinkedHealth Innovations and LinkedHealth Pensacola. And again, thank you for joining. Today, Cherie Magess, did I say that right, Cherie? Cherie Magess is joining us to talk about Medicare, Medicare Advantage, and help us all better understand all the many options that we have today to navigate Medicare. Cherie is the Director of Consumer Markets at Torgersen Causey. Torgersen Causey has over 22 years of experience in insurance and is a locally owned and operated Pensacola-based company. They are also a preferred provider for LinkedHealth Innovations. LinkedHealth, we are on a quest to align the highest quality providers of information and providers of healthcare to LinkedHealth consumers and followers. Today's topic is opportune as open enrollment for Medicare started in this October, so just a few weeks ago. And knowing your options is critical each year, as we all have. I have health changes that happened annually. And with those changes, it's always a good time to check and make sure your insurance coverage is up to date. Today's session will be an open discussion, interview style session with Cherie. We certainly will not cover all of the possible questions that you may have. But in the event that you have a question, I highly encourage, highly recommend that you reach out directly to Cherie at Torgersen Causey. Their number can be found and will be found at the end of this event. If you have questions, that's what this event is about. It's about connecting you with them to ensure you go into 2024 with the right insurance coverage. I think before we jump into it, I do want to make a big shout out. I already alluded to Torgersen Causey is a premier provider for LinkedHealth Innovations, and we thank them for that. So is Covenant Care. Covenant Care provides full suite post-acute care services for the Pensacola to Tallahassee area. If you need post-acute care services, hospice, home health, home care services, palliative, or even memory care services, we highly encourage you use them. They're a high quality provider that you will not be let down with. And so, Cherie, I think before we jump into kind of the moderator style questions, I do want to give you a chance to add any other disclosures before we jump right into some of the QA.
Yeah, so I just want people to be aware that rules and regulations can change year to year. So what we're going to be speaking about is for current information that we have from the Centers of Medicare and Medicaid Services, CMS, that regulates everything, all things Medicare.
That's great. And so what I'll add on to that is LinkedHealth Innovations. We are not actually an insurance provider. We connect the dots between people and information and some of the best providers in all of our coverage areas. I think we like to make sure that people are getting the best possible services. And so we invite, obviously, our partners like Torgersen and Cherie here online so that they can reach you and reach a broader audience. So with that, Cherie, I guess let's get talking. So I met you now, a number of months ago, and I think let's start with an easy one. How long have you been helping seniors? And I think the reason to ask you that is I caught the passion, obviously, from you in helping people navigate with what can be extremely complex. And so tell us a little bit about yourself and what drives you.
Okay. Well, I have been in the insurance industry for over 24 years now, primarily working with Medicare and Medicare recipients. I do have a passion for helping people. Don't know that I have a passion for insurance. I don't know who does, but I know that it can be extremely complicated, confusing. There's a lot of information out and about, a lot of different opinions. So I like to help people understand what is it not, how does it affect them, what are their choices, and what is best for them and their families.
So that's awesome. I can't, for our audience and for all of our future watchers of this, I can't overstate the value of having someone like yourself in an insurance company like Torgersen Causey in our area. Obviously, there are a number out there, but I can't tell you that I would go to, if I knew about you guys, I would go there, and I do go there for everything. So I think there's a lot of misinformation out there. So we thank you for that. So I think today, as we look at Medicare and Medicare Advantage, let's kind of build into the conversation. And probably the simplest one is, and we'll kind of step into this. What is straight Medicare?
Okay, so Medicare at its highest level is for it's health insurance for people who are over 65. If you're under 65 and have been labeled with a disability from the Social Security Administration and you've had that for 24 months, you can get Medicare. And then people who have been diagnosed with end-stage renal disease. So those are the people who are eligible for it. Straight Medicare, or original Medicare, as CMS would put it, is going to be Parts A and Parts B. Part A is hospital coverage. It also covers some skilled nursing, a little bit of hospice, and that is free if somebody has worked 10 years total in their lifetime, so 40 quarters. Part B is the medical portion of original Medicare. That is going to be doctors, outpatient, labs, basically anything not covered under the Part B, excluding self-administered medications. That does have a cost. Right now, for 2024, it's $174, and it can go up based on somebody's income if they're a high income earner.
So that's straight Medicare. That's not Medicare Advantage, and we'll talk about that for the audience. But
Correct.
That's just to get Part B straight Medicare coverage.
Yep.
Okay. And and I know we'll step into it. That does not include any pharmacy benefits, right? Is that
correct? Not self-administered. So anything like a chemotherapy or anything administered in a physician's office would be deemed under the Part B, as in boy, of the Medicare. So that's good news for that. But the self-administered medications that you would pick up at a pharmacy, no.
okay? All right. So that's fair. So let's add in a little bit more complexity. Medicare Advantage. Like, how do we go from, saying, no, I'm going to be straight Medicare to, okay, what are my Medicare Advantage options? And then why would I do Medicare Advantage over straight Medicare?
Yeah, so straight Medicare alone, there's gaps. So even though you're not paying for the Part A if you've worked 10 years, or you're paying that Part B premium, there's still deductibles, co-pays, co-insurances. There's no cap on what you pay. So a reason to go on a Medicare Advantage plan, which is what Medicare calls Part C, and they are plans that are administered by companies. They're regulated by Medicare, so they had to jump through all the hoops, get approved. There are different plans based on where you live. Most of them don't cost anything. And what you're getting for that are caps on your out-of-pocket for your medical. Most of them include the medications. They have to legally give you all of your A and your B benefits, so they can't deny you anything that the straight Medicare would have given you. And then a lot of them, depending on where you live, can have some different bells and whistles in them, some hearing, dental, vision beyond what original Medicare provides.
Okay. All right. So Medicare supplemental. So as a kind of now the third layer, Medicare, Medicare Advantage, and now supplementals. How do those play into the other two?
Yeah, so they would be an option to the Medicare Advantage plan. You went and have both. The supplemental, it is going to be a true secondary to your original Medicare. So once you purchase the Part B and you have the original Medicare, because of those deductibles and those co-pays and those co-insurances, there are federally standardized Medicare supplement policies. You'll also hear people call them Medigaps, because they are filling in the gaps of what Medicare doesn't pay. So you have plans A through L, so not to be confused with the parts A, B, C, and D. There are plans A, B, C, and D, and then through L that you can choose from that pick up all or some of what Medicare doesn't pay for.
Okay. So I know all this is we're stepping into, and the reason for having this call, obviously, I think it can get rather complex, and I'm going to throw some more at you. The VA, right? I think a lot of, obviously Pensacola, we have a large retired audience, and that's a great thing, right? Supporting our veterans. Now they have to figure out how do their VA benefits factor into their Medicare? Talk to me a little bit about that.
Sure. Well, for our veterans, first, thank you for your service, but they can just have their veteran benefits. The prescription coverage that they get through there is deemed credible, so they won't incur any type of penalties for not having a Part D. Or they can come out into this private sector. If they wanted to buy a supplement, they could. Most don't. They don't need that level of coverage. But there are some Medicare Advantage plans that exist, particularly for the veterans. So usually they don't cost any money. Some give part of their Part B premium back, so that 174 we talked about. Some of the plans will give some or all of that back. The caveat to those plans is they usually don't cover the medications, so they're able to give in other areas. But the idea is they're getting their medicines through the VA, so they don't need that piece of it. But maybe they want the flexibility to see private doctors, to go to facilities closer than maybe some of the VA facilities that they have to go to. Sometimes they have to go over to Gulfport for some needs. So that would give them the ability to stay here, stay a little closer.
So I'm the type person, a little bit old school. I like to see everything written down, assuming obviously somebody walks into your front door, whether it's virtually or in person. Do you help them put all that down on paper so that they understand when they leave, like where, it's almost like I think of it like a compass and a map, right? Mm-hmm. This happens, I need to do this, right? I don't think we do enough of that. Is that a fair assessment if somebody comes and sees you?
Oh yeah, the first thing I do is a needs analysis. What do you have? What do you need? According to the information that you have now. And then I do a lot of education. So a true consultation. Here's what Medicare is. Here's what it doesn't cover. Here are your options. Based on whether you're a veteran or not, based on your income, if you're a higher income earner, what to expect on that Part B. So we look at everything, explain everything so that person can make the right decision. Okay.
You mentioned this a while ago, and I'm just going to call it out a little bit for those listening. Spent 7-8 years in the post-acute care market, and I think it's very important to understand that Medicare, your straight Medicare option covers hospice for everyone out there, and will cover, as Cherie said, some of your skilled nursing days. Once you elect a Medicare Advantage plan, what does get roped into most, and Cherie, keep me honest, if not all Medicare Advantage plans, is certified home health, right? That is not what we call an industry a carve out. Hospice is carved out of those plans and still covered under straight Medicare. And I think it's important to know that, as my next question. An important part of knowing where you're at Medicare is acknowledging that each year you're going to have, we're all going to have different things health-wise that come up. And so somebody that starts on Medicare at age 65, figuratively 100% healthy, not necessarily any major health issues, as we all progress and get, start to have health issues, it may make sense to change coverage. And so I guess talk about how important it is every year that they at least go through their own internal what's covered, and maybe talk about their access to wellness exams and whatnot that will help them each year.
Sure. Well, it's a lot there, but first and foremost, you definitely want to take that time to reassess. So that's what this open enrollment, actually Medicare calls it your annual enrollment. So October 15th through December 7th is when you can say, what has changed? What are my needs? My finances, maybe, medications, because all of the Medicare Advantage plans or your Part D prescription drug plans can change their formularies, or maybe your drug list has changed. Something to keep in mind with the Medicare Advantage plans is they're network-based. So you've got HMOs and PPOs. So, when you sign up, you always want to make sure that your providers are in network, or know that if one doesn't, what the higher cost is that you're going to pay. The Medicare supplements are not always guaranteed issue, meaning they can deny you for health reasons. So you always want to review whether or not you want to pick that up, whether you're new to Medicare or coming off of group. Those would be 2 times you can get the supplements without answering health questions and potentially be denied. And so every year, if you're on a Medicare Advantage, you want to assess your health and reconsideration of a Medicare supplement going forward. So those Medicare supplements are not network based. So anywhere that will take Medicare will take the supplement. So you may now be seeing new doctors that maybe don't take the HMO or the PPO, or maybe they don't take Medicare Advantage at all. Maybe they want you to have a supplement. So there are many reasons to reassess what you need going forward and where your health is at to see if you can even get stuff going forward. As far as the wellness goes, I mean, there's a lot of preventive services, and you just don't know what you don't know, right? So use your free services, whether you're on straight Medicare or Medicare Advantage. You know, get your annual physicals, mammogram, pap smears, PSA testing, specifically prostate cancer. If you catch that early, highly curable, late, not so much. So the more information you have about your health, the better it is so we can make a decision going forward, because typically once you make your decision, you're essentially saying you're going to stay in that plan for a year. That's a big deal.
So you mentioned, and I skipped over an important part. So if you go Medicare Advantage, it's very important to make sure that you check the doctors that are in that plan, right? Because essentially it's a management group for our listeners, much like the old style HMOs. And so there are doctors that are considered in network and out of network, right?
Correct. On both the HMO and the PPO.
Okay. All right. And so, and also revisiting, I think it's important that everyone, understand, I think as we all have more complex conditions, home health is inevitably, it's a tremendous service, right? Ideally, we heal better in home. We have family, we have support groups. And so to the extent we can get certified skilled home health in, when we need that, it's important to know your Medicare Advantage options, know what they provide by way of who's in network. Very important. We're coming up to this time of year where a lot of people who are forecasting that they're going to need home health episodes in 2024, very important for them to talk to you, Cherie, because it'll put them on a path to either maybe they need to change their plan, right?
That's right.
Maybe they need to go straight Medicare. You can help them navigate that. If we see a year coming up that might be more challenging than the years prior, very important for you to reach out to Cherie.
That's correct. Yeah.
So talk a little bit about a very little known window of opportunity. So we are in, and keep me straight here, we're in open enrollment now. Is that right?
We're in, Medicare calls it annual enrollment period.
Okay, we're in annual enrollment, but once that closes, so I'll pause there. So when does that close?
So that will close December 7th. So whatever your last application that you did, let's say you jumped around a little bit, which is completely fine. This is your opportunity to do that. Whatever Medicare has on file for you on December 7th, that's what they're going to start you on January 1st of the following year.
Okay. And so take me into next year. We had discussed this offline. I think I didn't realize it. And so as we go into 2024, if I'm not entirely satisfied with what I've chosen, is there another opportunity for me to change?
Yes, for people on Medicare Advantage. So they don't advertise. Insurance companies aren't allowed to advertise, nor can agents, but it is in your Medicare and You handbook in 2024 that you should have received. But it's a time called open enrollment period. For people who are on Medicare Advantage plans, they can switch to another Medicare Advantage plan between January 1st and March 31st, or they can go back to original Medicare, pick up a supplement if they're able to. So remember, they have health questions unless you're in a guaranteed issue situation, and then get a drug plan. The difference, other than you have to be on Medicare Advantage to have this window is it's a one-time change. And I stress that to everybody because let's say it's January 2nd and you make that change, that's what you're locked into for the rest of the year. So it doesn't matter that we still have till March 31st. They are very clear. It's a one-time. They get something new from you, that application, that's it. You're done for the year. Unless you have a special enrollment periods, like if you were to move, for example.
So maybe trick question for you. I think ideally we have caught everybody before they go through this, and they all storm Torgersen Causey and you but in the event that maybe somebody on October 1st, was it 2.5 weeks ago or 3 weeks ago, was perusing and they were navigating AARP, and AARP says go to this Medicare Advantage plan, and they're hearing you. Can they? Is that too late? Can they still talk to you, or are they locked in with whatever plan? I mean, if they went to AARP as some other insurance vehicle.
Right now in this annual enrollment period?
Yes.
No, December 7th. You can see an agent every day of the week and enroll into a new plan every day of the week. Whatever is on file December 7th, that's what you get. So definitely use this time. Shop if you need to, especially if your needs have changed, but it's a very competitive market. So there's always new plans coming along. So it never hurts just to see what is out there. That's kind of a rule of thumb that I tell people. Of course, if you do nothing, whatever plan you're on, you just roll over into, but it doesn't hurt. A good way to shop too is if you're seeing specific physicians or going to certain facilities or want a specific skilled nursing provider, you can shop backwards. You can reach out to them, which I always encourage, because there are online directories. Every company has one where you can find out who's in network, but those aren't always up to date and accurate. So rule of thumb is to reach out to those providers and find out what Medicare Advantage plans they accept. They are very used to those phone calls.
Yeah, so I'm glad I asked that question, because healthcare is very personal. Whether, I know we're all post-COVID and we're used to telehealth, but even in that exchange, it's very personal. And I don't have anything against the large, the AARPs of the world and the AAAs of the world. But what I would tell everybody is keep healthcare local, right? It doesn't hurt you to go talk. If anything, Cherie's going to say, yep, you chose the right plan, but at least you'll feel better and have somebody more personable to listen to that knows Pensacola. So we all know the changes going on in Pensacola. We know our healthcare systems, Ascension Sacred Heart, West Florida. We know the New Baptist Hospital. We know all of the post-acute care providers, ambulatory and skilled nursing. They will know more about those networks than any online directory that you're going to get via some non-Pensacola owned provider. So you kind of alluded to this. Obviously, we're all pinched a little more financially these days with inflation. Are there different? You mentioned some of the cost options for Medicare. Are there tiers for Medicare Advantage, or is everyone pays the same thing? How does that work?
Yeah, no, the majority of them don't cost anything. It is county specific. So in our area, there are a lot of no cost plans. There are some that do have a cost associated. The reason for that is usually their formulary, which is the list of drugs, might be more robust. Mm-hmm. And so that's what you're paying for. Might have lower out-of-pocket costs. And then if you go into different counties, so if you've got family down in Miami-Dade, they may not pay anything for anything. Or if you're going into remote areas, kind of over in Bay County, they may be paying, $50 a month for their Medicare Advantage. So it is based on where you live, what company, and what the plan is offering in and of itself.
So are doctors locked in, or can doctors come and go out of those Medicare Advantage from obviously who's in network, out of network? Is that pretty locked in?
Well,
annually?
You don't see a lot of movement in that area, but they are definitely not in a calendar year contract. So, there have been times where, physicians have left, mid-year, and there's not a whole lot you can do about it unless you have a special enrollment period if you're in an Advantage plan. So, short answer is no, they're not locked in.
So the reason for asking that, it's more reason, I think, to make sure that you have Cherie kind of on speed dial here, figuratively, is that as we all have changes, I think as the year progresses, we need to continually make sure what doctors are in network, right? And so
Yes.
there's websites that I know that they can get from you that I would trust much more than getting from just a Google search. So I think that's very important. Do you guys, I guess, real quick, do you provide a list of you provide a list of all the physicians that are in the products that you're selling, right, from a Medicare Advantage?
Yes, they don't print them anymore because they're the size of phone books,
Yeah.
but there are resources where we can create smaller lists if you're looking for a primary care physician or a certain specialist. Yes, we can definitely provide that.
So you mentioned Medicare, we mentioned Medicare wellness exams, and I think when you look at that, to throw a couple stats out for our audience, and there's a number of different reasons, and it costs a really casting a broad brush. It's different in different markets, but there's historically very low adoption for the Medicare wellness exams amongst seniors. It's actually remarkable. And in that, they're missing a free service, right, that Medicare is providing, that is able to make sure that they identify possible, complications and illnesses well ahead of time, as you mentioned, prostate, and they cover certain services. Probably more of admiring that issue. Probably a random question. How do we encourage more seniors to get that wellness exam, right? Ideally before even the October 1, right? That day, that way they know what's coming.
Yeah, well, interestingly enough, the Medicare Advantage plans all have a star rating from CMS, and a lot of that is customer service, claims processes, turnaround time, but also are the members going and getting their wellness exams. So you will find that these carriers will send mail, emails encouraging people to go. And so with my particular clients, I make them aware of those communications, and then also remind them myself of all of the freebies, if you will, that they have available to them.
Yeah, I think it's a service also that we always want to make sure at LinkedHealth that we are aligning with the right providers that are in someone's Medicare Advantage plan, to ensure if they need help finding a primary care physician or a geriatrician or an internist, or even a specialist. We have insight, much like you do, into the local providers in town. And while we want to believe all the doctors are awesome, and they all are awesome, but some are better at certain things than others. And so it's just important to know what options you have in front of you. So
that's right. Be your own health advocate, for sure.
Yeah, absolutely. So Amazon, we all love our Amazon. We all love our convenient delivery. And I had to bring it up because more and more people are relying on everything from DoorDash to obviously Amazon. I think I get a few packages each and every week, thanks to shopping habits I won't talk about. But do Medicare Advantage plans support that kind of pharmacy as well?
They do. I mean, I can't speak for every single one of them. You always want to double check what the benefits are, but yeah, they've just about all got contracts with. Some of them have preferred pharmacies, the brick and mortar ones, and then some of those mail order vendors as well. So you always want to double check. You don't want to make any assumptions, but yes, they do.
Yeah, I think that's important. I think you see more and more people. We see more and more external, we'll call them external players to healthcare that we don't naturally think of as in healthcare, but they are providing more and more services to our front door. So I think it's important that our audience ask those questions, because I think a lot of the providers now, not only the brick and mortar providers, but there's a lot of options that I think that are getting added to Medicare Advantage around telehealth services by the non-typical provider, right? So I think it's important that everyone knows. Kind of went over this, but I'm going down my list. Medicare supplemental plans.
Mhm.
Are you tied into them annually as well, or can I at 6 months select a different Part D plan for my drug benefit?
So you're not tied into the supplement. Those are not subject to the enrollment periods, but the Part D, yes. So you have to be very careful, because normally if you've got a supplement, you've got a Part D, because neither Medicare nor the Medicare supplement cover those. So you can enroll into a supplement anytime, if you get past those health questions. But you can't always enroll into the Part D. So you may have to wait on that, or you can change your supplement, but not your Part D until the enrollment periods. So you definitely want to be aware of what you're doing. Be careful.
Okay. So I'm going to go a little bit technical here. You mentioned skilled nursing facilities earlier, and traditionally, and not to put you on the spot, I forget how many days are allotted for skilled nursing each year.
Well, they go by benefit periods. It's 100 per the benefit period.
Okay, and that is straight Medicare, and a lot of people think when they hear nursing, they think skilled nursing, and they're maybe bleed assisted living, nursing home, and bleed it all together, but they are different. And so, does Medicare cover assisted living?
They do not, as far as it comes to the facility and the actual oversight and custodial care. If there's some of the facilities will have some skilled nursing in there, not a lot of them, but they can. So if there are any items that are deemed skilled nursing, so wound care or some nursing, then yes, but mostly no.
What about rehab? If somebody goes into inpatient, what we call an entry and IRF, but an inpatient rehab facility or critical care.
Yeah, so that is covered. That is under the umbrella of the skilled nursing. So basically, it all is going to boil down to those codes. And so if it's deemed the skilled nursing for the inpatient rehab or the critical care, then it's going to be covered under that 100-day benefit period timeline. People don't pay anything for the first 20 days, and that's under straight Medicare or an Advantage plan. But then there can be some out of pocket for days 21 through 100. Some of the supplemental plans will pick all or some of that up. And then the Advantage plans usually have a per day, but you've got a maximum out of pocket cap on that. So you do want to be aware of what you have and how it operates, because that can be a lot of money in the pocket.
So it's fair to say, in a way, people can drift in and out of the different areas. I'll call it areas of Medicare, because you could start figuratively healthy, have a critical event, right, which puts you into a hospital. All of that theoretically is, if you had a Medicare Advantage, would be covered under a Medicare Advantage. If you have to go into an inpatient rehab facility, that could be Medicare, could be Medicare Advantage. If you get referred home to home health to continue your rehab, that's certified skilled care, and then hospice is straight Medicare. And I'm kind of outlining that for our listeners and audience here, because that is not an uncommon trajectory. And I think what I hope to do is make sure that you have to be aware of your insurance options throughout that. But how do we make sure it's as clean as possible, if that makes sense, right? And so maybe not so much a question, and probably back to the original opening, is, how critical is it that ahead of each year on what you have, or what's covered under what?
Yeah, it's extremely important. You know, when you're new to Medicare, that transition is pretty rough. You're taking in a little bit, you're kind of getting used to it, but you may not be thinking about all these little odds and ends, the skilled nursing, if you're not going through anything at that time. So every year you want to meet with somebody. We can sit down. I go back over, here's what it is, here is what it's not, here's what it covers, what it doesn't. Here are your options. Here is your out of pocket if you go this direction or this direction. You know, if you do the advantage, you want to make sure your providers are in network. So it's very important to reassess every year.
So what you're saying is we just need to come see you.
Yes, I will help
That being said, I think we are in the age of AI, and if any of our viewers, if they follow us, they know that we released Ruby, which is the area's first virtual care navigator. Ruby is to get technical is essentially has all of the AI that everyone has heard the buzz terms about, but we have very intelligently made Ruby aware of everything that's particular to our market, is so that she can answer more detailed questions about Pensacola, about Tallahassee, and in the event that you do need to talk to somebody, Ruby can then connect you to Cherie, so everyone's aware. But we did ask her, because I think it's fair. It's a question that I expect her to get asked a lot, is what are 3 common misconceptions about Medicare? And Ruby, believe it or not, I believe had 3 good answers, but I'm going to ask Cherie that. Ruby's answers to that question were: Medicare covers all expenses, misconception number 1. Medicare is free, misconception number 2, and Medicare covers long-term care expenses. So how did Ruby do on that? I know it's a very generic question, but how did Ruby do on those 3?
Very well, very well. Because as we're just trucking through life and working and paying into the system, and we see that Social Security part, Medicare part come out of our checks, we make a lot of assumptions, and we can't do that. So even pre-retirement, even several years before, you might want to do a look ahead. You might want to sit down with somebody like me. That way we can help project some expenses, because the long-term care is not covered at all. Medicare is absolutely not free, and it is based on your income. And we do have higher income earners in our area. And then there also, for the low-income folks, there is assistance out there. There's a state Medicaid program that will help pay that Part B premium. There's a federal program that will help people cover their medications, but you won't know any of that until you get in front of somebody. And then as far as the out-of-pocket, even when you're paying for these insurances, there could still be some extra out-of-pocket that you just want to be aware of and plan ahead for.
So you mentioned something there, and we're coming up close to a kind of a final question I have for you. But before I get there, there's always a financial conversation here. Do you help customers have that financial conversation? I mean, do you do some financial planning with them? And if not, do you refer them out to somebody who can help?
So traditional financial planning, no. I do send them out, but when it comes to the insurance piece, yes, I do dig in. The Medicare supplement plans on average are about $200 a month. So that ends up being a question right up front. Is that even in the budget? So do we even look at that as an option? And then there are a lot of people that's a no. And so then we go straight to the Medicare Advantage plans that don't cost anything. So yes, I do ask those questions. Also, if you're a higher income earner, I've got a chart that says, is your Part B 174 or is it 560? That's a big swing depending upon your income. And Medicare does a 2-year look back. So that could be very different from your retirement income. And then for the lower income folks, I help them be aware of those programs and point them to the resources so they can get that financial assistance.
Okay, so that brings up another question. So you guys are going to find this. Every question is going to lead to a question in Medicare.
Yes, essentially.
I'm trying to stump Cherie here. Dual eligibility around Medicaid. How does that play into some of this?
Yeah, there are people that are eligible for both Medicare based on their age or disability or ESRD, and then Medicaid based on their income and assets. And there are some special needs Medicare Advantage plans that are out there. So, if you've seen the commercials that say you can, buy the groceries and get the car rides, those are usually for the dual, the Medicare, Medicaid folks. Because those Medicare Advantage companies are now getting funded from Medicare and now Medicaid. And so they're able to do a lot more with that money and give a lot more benefits, but you do have to qualify.
Okay. So what I'm hearing is plan, and more plan. So
get information for sure. Find out what is out there for you.
Yeah. I think because there are just so many options, obviously, from everything we've covered to Medicare, to dual eligibility, to even estate planning, and we don't have our partners Waddell and Waddell on, and so I won't go into too much depth, but obviously everything around elder law and estate planning, there are people out there that we can get you in front of, both myself and Cherie and Torgersen Causey, to make sure that you're asking and getting all the questions answered that you need to have answered. So as we come up to a close, Cherie, I mean, what did we miss? I know everyone needs to come talk to you, but summarize, I think, where we've been in this conversation, if that's fair.
Sure. I would just encourage everybody to use an agent. They don't cost you any more to use an agent. You can go out and do things on your own. Most everybody's computer savvy these days. You can get on your phone. But just this past week, I had a gentleman call because he enrolled himself in a plan and his doctor didn't take it. He didn't find out. Just went this past few weeks. And so now I'm going to help him do that. So, use an agent. It's not scary. Again, doesn't cost any more. And, don't make assumptions or decisions based on what your friends are doing or what other families are doing or what, a doctor is telling you or a medical professional as far as insurance goes. There's not a one size fits all. And so you really need to find out what is available to you, how does that impact you, and affordability.
Well, thank you. I want to, we actually surprisingly don't have any questions, but I think, as I mentioned in the opening, this will obviously be out there for all of you guys and all of our listeners. And I am pretty certain that it's going to get a lot of listens and a lot of views. In closing, I do want to thank you, Cherie. I mean, for taking time. It's a very busy time of year for you. I know, not just for Medicare and Medicare Advantage, but for obviously you commercial insurance as well. And so we thank you for your time. And Torgersen Causey, I think for our viewers, the intent of this is to obviously get you thinking, get you talking, and get talking about health and wellness. I think the first step in every process is knowing what information is out there, accessible, and probably most importantly, where to go and get those services. And so if you have any question in this regard, please reach out directly to Torgersen Causey. I guess, Cherie, you want to give us your number? How do they call you directly?
Yeah. Call my office, 850-433-9996. And thank you for having me.
No, awesome. It's been great. And I think what we'll do is we'll revisit this, and I appreciate everyone's time, your time, and everyone have a great afternoon.